Hello, everyone. Welcome to the heart-to-heart session on the screening strategies in hypertension. Detect early, live happily on World Hypertension Day, the 17th of May, 2023. World Hypertension Day was an initiative by the World Hypertension League, that is the WHL, is a non-profit international organization founded on the 4th of January, 1984. It's dedicated to preventing and controlling hypertension at the population level. World Hypertension Day was first launched on the 14th of May 2005, and since 2006, World Hypertension League has been observing 17th of May of every year as World Hypertension Day. The day is aimed at increasing awareness of hypertension due to the lack of appropriate knowledge among patients with hypertension. This year, it is celebrated under the theme of measure your blood pressure accurately and control it for a longer life. The major objectives of this WHD are awareness of symptoms of high blood pressure, motivation to know blood pressure measurements, knowledge of early prevention methods of high blood pressure, highlighting the prevalence of high blood pressure in the community. Today we have with us an eminent cardiologist, Dr. Saumitra Ray from AMRI Hospital, Kolkata, who will be highlighting some of the major facts on hypertension management. Thank you, Dr. Ray, for consenting to be here with us today and address our common questions to our listeners.
Hello, Dr. Ankur.
Yes, sir. As per recent WHO guidelines, more than 700 million people, 70 crore people worldwide are with untreated hypertension. What's the probable cause behind that? Has it been undetected and remains a silent killer in our population?
Yes, as you mentioned, it is a silent killer, and Indian statistics shows that around 30% of adult Indian population are hypertensive, a bit more in the urban areas, slightly less in the rural areas. And not only in the adult population, even in children, school-going children, in the teenager children, they also have around 20% incidence of hypertension, as shown by a recent study from the and most of them are obese. Obesity is the commonest cause in childhood hypertension. But as the world statistics goes, 50% of people who are hypertensive are never detected as hypertensive. Of those detected, another 50%, that means 25% of the total hypertensive population are treated. And of those treated, another 50% are only getting the control. So it is not more than 10 to 15% of the total hypertensive population are getting their blood pressure under control by present day guideline. And as the guidelines change and the blood pressure threshold reduces, the figure will be even more appalling. Not more than 5 to 10% will meet the present day hypertension control criteria. The commonest cause of undetection, Dr. Akbar, as you are mentioning, is that pressure is a silent disease. It does not cause any day-to-day symptom, so the people do not feel that they have got any disease, and even when incidentally detected hypertension, they do not feel the need to take the treatment regularly because it is not doing any harm to them in their day-to-day life. So they do not know the consequences of hypertension.
So I was asking, we agree that it's a silent killer, and it's just a few people who have actually only less than 50% have been identified. What are the screening strategies we can take to combat this silent killer, that is hypertension?
Yes, absolutely. The screening strategy should come from different levels. From the national governmental levels, their main objective should be to spread the awareness of undetected hypertension and the consequences of that by different media, print media, by electronic media. The media people should take up the responsibility as the social duty to spread the knowledge of hypertension. Then at the social level, the social workers, the NGOs, they should also have their curriculum or projects to spread the knowledge, as well as for screening camps for hypertension, health camps. It can be done at the school college levels also. During the entrance to the college, while filling up a form, a person can sit over there with a blood pressure machine. When a person is going to fill up a form to enter a college, his pressure is being checked. These sound funny, but these are very effective to catch those people. And also in the doctor's chamber, many times the non-physician doctors, they do not check the blood pressure because that is not in their immediate need. But that is a great opportunity which is missed. If every patient walking into every clinical establishment gets their blood pressure checked, and not only the person himself, his accompanying person, his friend and relative, if their blood pressure is also checked, that will be a fantastic area for a mass screening. At least it will catch up a sizable portion of the society.
How does hypertension affect the overall health economy of our country, sir?
Yes, hypertension is not only a killer, but also, as you say, it is a maimer. It makes the people invalid for a major portion of their life, and even when they are in the prime of their career. The first important example is stroke, a brain stroke. When the patient gets invalid and maybe bedbound for the rest of his life with nursing care, with physiotherapy care and other social support, he is not only losing his working capacity and earning capacity and effective contribution to the nation's economy, but he is also drawing the health budget for his and his family's further sustenance. Same thing happens with heart failure. Many people with advanced heart failure are bound to bed or spend majority of their time in hospital, hooked to an oxygen cylinder and other gadgets. That also often happen in the prime of their life, in their 40s and 50s, when they could have earned and contributed to the society. And the third important area is dialysis, because end-stage renal disease, a very common cause is hypertension, and you know the health budget the dialysis draws, and the family and the social impact of a person, of a family, if he goes into dialysis 3 times a week, he cannot have a useful social life to move around, to go for holidays, not only for earning and other things. So these 3 ways, it not only draws the health budget and spends money from the family, but he doesn't also contribute to the nation's growth economically, and he cannot utilize his skill and his experience, whatever he has gathered. So it is a loss from both sides to the nation.
What do you feel about home-based blood pressure monitoring? How does it affect with regards to the various different guidelines which we have?
Yes, various guidelines across the world has put the importance of home-based monitoring, because it gives a motivation to the patient that he's checking his own blood pressure, he's taking responsibility of his own health. And the doctor also has a very good insight about what is happening in his day-to-day blood pressure. It actually stops the over-treatment and under-treatment both ways. But at the same time, once a home blood pressure monitoring is acquired by a family or a patient, he is not only benefiting himself, he is benefiting another 100 people. Because it is a common psychology, if there is a blood pressure machine in a household, all the family members, all the guests, all the friends visiting to that household will get for fun, even not for fun, just to check their blood pressure. And it is a huge way of detecting those undetected, unsuspected person. He thinks he's a completely happy, healthy person, just checking the blood pressure because it is available in his friend's house. And he might get the blood pressure detected for the first time. So this is a huge opportunity to get it popularized, the home blood pressure machine, not only for the patient himself, but also for his surrounding people. And it is cheap nowadays, easily available Indian-made varieties all across the country. So I strongly, I am a proponent of this measurement.
That's lovely, sir. How can the government play a major role to take the new initiatives for patient awareness to combat the emerging pandemic of hypertension? We've had our communicable disease, that is COVID, it's on its way out, but the non-communicable disease, that is hypertension, is on its way up. What will be your message to the young population to fight this new pandemic?
The government is actually on the right path. They have increased the health budget over last 2 decades. It's now to some extent reasonable. It was very low before. Secondly, they have given emphasis on the non-communicable disease, hypertension, diabetes, cancer, which was not there, which was tuberculosis, malaria, leprosy before. So they have shifted their focus now because the data are in front of them. So their main job is to spread the knowledge of undetected hypertension and its grave consequences. That is the most important thing government can do. They can arrange the health camps through their different primary health center, secondary health center. And you know, the various NGOs and societies like Cardiological Society of India also arranged, and it was in Guinness Book of World Record that one single day the maximum number of people were screened for hypertension all across India. And it was a very unique thing in the world which was done. The pressure was measured in the bus stop, in the cinema hall, in a shopping mall, everywhere they get hold of some person who is willing to do it, in the airport. So these are the areas of screening you can do. But as I say, it should be much more focused to begin with, like schools and colleges, like the doctor's chamber, like the primary health center, when a person may come with a different reason, but blood pressure check should be done as a routine measure for all healthcare contact of a person with the healthcare personnel. That will go a long way in detecting hypertension and controlling hypertension to prevent its consequences.
What about for the young population, sir? Anything specific towards them?
As I mentioned before, we usually forget to measure the blood pressure in young people. We think they are not prone to have hypertension. But surprisingly, in Indian statistics showed about 20% of urban school children are already hypertensive in their teens, and majority of them are obese as well. So these are the target group, obese people who have got a very lazy lifestyle, who are smoker, who have got family history of hypertension, who are under a lot of stress and strain and psychological trauma. They should be targeted first. Then the yield of screening will be more, and you will get more and more percentage of hypertension for the population you are checking. So my message to the young people of India is that don't think that only your father and grandfather can die. You can also die of hypertension. So check your blood pressure, and to live a healthy life when you are at 40 or at 60 years, get your blood pressure controlled at the moment. Don't think that you are on the safe side.
Thank you, sir. Thank you. I'm sure you made a very morbid topic a little bit more cheerful and joyous with your smile. To summarize, it's a silent killer, everybody. Before it kills, it maims. It has a big iceberg phenomenon where only a little bit of the population is aware that they have the problem. India is on the right path. We've had the Guinness Book of World Records through our Cardiological Society of India to set the most number of screening done in a day. Our input would be all specialty physicians should check hypertension at their OPD, and everyone who walks into any college should be screened before their admission process. Economic loss is huge with strokes, heart failure, and renal disease because of hypertension. Home-based monitoring is the way forward. Get together, have fun, and during your festivals, measure for even your close loved ones. That could be a good, instead of a mithai dabba, you can give a hypertension monitoring.
That's a great idea.
Thank you, sir.
Thank you.
Thank you, sir. Thank you for a lovely session. I had a lovely time interacting with you, sir.
But we all pledge for the healthy India, healthy nation.
Absolutely.
So
Absolutely.
Thank you, Doctor.
Thank you, sir.